My name is Manuel Celadon. I'm the Assistant Chief of Emergency Medicine at the Greater Los Angeles VA. And I also, along with Joni and Zahir, spearheaded our ED MOUD program. We didn't really have any treatment options, right? It was a goodie bag of like, here's some Motrin, some Zofran, some Imodium, and maybe some Clonidine, and you know, good luck, right? And here's a referral to this treatment program that may or may not help you. It's like, there actually is a path, there's a better way to do this. Passing the buck on to somebody else is obviously not helping anybody, and it also incurs some moral injury on my part, right? Because you know, you do kind of go back and realize, like, am I making this patient more addicted?
Yeah, I'm Hemang Acharya. I'm an emergency medicine physician here at the Greater Los Angeles VA. Yeah, I did residency down at UCLA Harbor with Manny and Zahir, and then I did a fellowship after that at the other UCLA in health equity and leadership, and with that I got an MPH, which is kind of how I got into this space of public health, and specifically with an interest in like substance use disorder and interventions that we can do there. So we're trying to bring like more of these programs into the emergency department in general. So this is like a big one that we have in substance use disorder, but we're also trying to do some homelessness interventions and things as well and combine those.
I think one of the things that's really important when you create programs like the Addiction Scholars Program is follow through. I think it's really good to get educated, it's really good to gain those skills, but then what, right? Now what, right? And so I think what the capstone project in the program, the aim of that is to continue engaging the addiction scholars and providing the support, not just financial support, but also the mentorship support to be actually able to develop their own projects, right?
The capstone project is for the people who have participated in the Addiction Scholars. It's kind of the culmination of all the extra training that they did, where they get to actually apply these skills that they've learned. Some of my senior leaders in the department, they were participants in the Addiction Scholars program last year. They wanted to bring some of the things they had learned into our department, specifically around opioid use disorder and substance use disorder, and see if there are any programs that we could implement from the emergency department side of things. And you know, we've collaborated with some of our colleagues also in family medicine and psychiatry, and we're trying to kind of develop like multidisciplinary and also like multiple location sort of program where we can perform some of these interventions.
The initial idea is a good one, is you know, how do we give people enough exposure that's high yield in addiction science, addiction medicine, to be able to help them care for patients on a day-to-day basis. And now it's kind of turning into, you know, how do we manage the more complex patient with chronic pain on top of opioid use disorder. And so it's been layered on. Again, initially it was more of a intro, and now we're trying to target more of the patient that everybody's seeing in the ED or in the primary care. And really empowering physicians to be able to take care of that patient, because it's a multidisciplinary approach that you need, and if you don't have a foundational base of knowledge, it's really difficult.
I did my medical school out on the East Coast, and I would say every single ER shift I did there, we would give like Narcan multiple times a shift. Up until, I would say, maybe a year or so before the pandemic, and very much more so during the pandemic, all the opioid use disorder has like escalated rapidly. Now we give Narcan like fairly regularly here, whereas before hardly ever give it, honestly. So anecdotally, I can say I've seen a lot more opioid overdoses, both intentional and unintentional too, like we were talking about adulterated drugs earlier. So, and I think that's been reflected nationwide too. I think in like every major city that kind of all substance use disorders on the rise, opioid use disorders on the rise too. So I view it as like unfortunately, like increasing public health problem, so.
It's kind of built into the culture now. I mean, it's pretty amazing. It's like second nature for all our physicians to think about naloxone before ED discharge, which I feel like is a big change. We're lucky that our group really kind of bought into it.
The things that we're doing are pretty new programs and new types of interventions, so in a way there's not really a lot of like a blueprint or guidebook on what we're doing. We're using like the best practices from what we can gather from like other VAs, for example, or honestly other countries. Like you've probably heard countries like Portugal have gone like full harm reduction program with their public health approach to substance use disorder. So kind of looking at some of those models are guiding us, but I think, you know, if we're able to develop a program that's sustainable and successful, then it's easier for us to bring in, you know, younger generations of people to advance it further and go into other places that I probably can't even think of right now. So I'm hoping that will be our role in the future once we kind of get this off the ground.